Hello friends, today I am going to discuss with you question number 6 of Katherine Anderson mrcog part 1 book. In this question, topics to be discussed are tibial nerve, common peroneal nerve, femoral nerve and sciatic nerve. But in this video I am only discussing about tibial nerve. In this video I am going to discuss briefly about tibial nerve, tibial neuropathy, tarsal tunnel syndrome and percutaneous tibial nerve stimulation. As this exam is related to gynae ops, we don't need to go to much detail about tibial nerves and its branches, but we should know briefly about tibial nerve. So the question is, with regard to innervation of the lower limb, tibial nerve is derived from L4 to S1. Now, tibial nerve. Tibial nerve is a branch of sciatic nerve. Nerve root is L4 to S3. It arises at the apex of the popliteal fossa. It travels through the popliteal fossa, giving off branches through the muscles in the superficial posterior compartment of the leg. It also gives off branches that contribute towards the sural nerve. During its course down the leg posterior to the tibia, it supplies the deep muscles of the posterior leg. At the foot, it passes posterior-inferior to the medial malleolus through the tarsal tunnel. With course downward, also supply intrinsic foot muscles. Immediately distal to the tarsal tunnel, the tibial nerve terminates by dividing into sensory branches which innervates the sole of the foot. Now we should summarize it. The tibial nerve gives branches to the superficial posterior compartment of the leg and also gives branches to the deep muscles of the posterior legs, and as it goes down it also supplies the intrinsic foot muscles, and its sensory supply is the sole of the foot, although it has branches which supply the plantar surface of the foot, but main tibial nerve supplies the sole of the foot. This is a diagrammatic presentation. See, sciatic nerve is divided into tibial nerve and common fibular nerve or common peroneal nerve at the popliteal fossa. In this diagram, you can see that the sensory supply of the tibia is the sole of the foot. In this diagram, you can see that the tibia supply the sole of the foot through medial calcaneal branches, and rest of the plantar surface of the foot is supplied by the lateral plantar nerve and the medial plantar nerves, which are branches of the tibial nerve. What is tibial neuropathy? Damage to the tibial nerve is rare and is often a result of direct trauma, entrapment through narrow space, or compression for long period of time. Symptoms are pain and a change in sensation in plantar aspect of the foot and toes. There is also pain located around the medial malleolus. Damage results in loss of plantar flexion, loss of flexion of the toes, and weakened inversion, although tibialis anterior can still invert the foot. Now, what is tarsal tunnel syndrome? It refers to entrapment and compression of the tibial nerve as it passes through the tarsal tunnel. Patient may experience altered sensation in the sensory distribution of the tibial nerve, the sole of the foot. The motor function can also be affected in severe disease, causing weakness and wasting of the intrinsic foot muscles. As you know that the tibia supplies the sole of the foot, and its branches, medial plantar and lateral plantar nerves, supply the rest of the plantar surface of the foot, but those branches not passes from the tarsal tunnel, so that part of the foot is spared. Only sole of the foot is involved in tarsal tunnel syndrome. The management can be conservative or surgical. Conservative management is through physiotherapy, NSAIDs, corticosteroids injections. Surgical is by tarsal tunnel release, cutting through the flexor retinaculum to decompress the tarsal tunnel. Now, what is percutaneous tibial nerve stimulation? Bladder and bowel function is controlled by a group of nerves called the sacral plexus. Stimulation of these nerves can help to improve bladder and bowel problems and is achieved using an implantable stimulator or by percutaneous tibial nerve stimulation. Now, percutaneous tibial nerve stimulation is a minimal invasive outpatient procedure to improve overactive bladder symptoms. Overactive bladder is a condition that causes urinary symptoms including frequency, urgency, and urge incontinence. Percutaneous tibial nerve stimulation is offered when conservative measures and medications did not improve symptoms. So the question was, the tibial nerve is derived from L4 to S1. It is false because tibial nerve nerve root is L4 to S3. Thanks for watching. If you like my video, please subscribe to my channel and click the bell icon for more updates. Rest of the question I will discuss in my next video.